Hi, my name is Alexa Andre. I'm a second year student at the University of Washington School of Medicine, and I'm going to talk about my summer experience with RUP. My research centered around dental care for low-income community members in Wenatchee, Washington. This is an issue that's near and dear to my heart. I grew up in Wenatchee, and I've witnessed this as a huge public health issue in our community. Speaking with a patient facing this struggle to access dental care during my RUP experience really brought this issue home for me. There are a lot of factors for why this is such a huge issue. First off, Medicare coverage does not include dental care. Therefore, low income patients must either pay out of pocket or attempt to access Medicaid dental coverage. But even with this coverage, most dental providers in Wenatchee will not accept Medicaid for adults or have long waiting lists for these patients. The most recent Community Health Needs Assessment also notes this as an issue under one of the top 5 public health concerns, in which they note a serious lack of providers, especially dentists, who accept Medicaid. Likewise, the 2016 National Health Interview Survey found that, regardless of income level or type of insurance, more people reported financial barriers to receiving dental care as compared to any other type of healthcare. The evidence really shows that this is an extremely important issue because even though dental care is sort of sectioned out into its own silo in terms of insurance coverage, there are real systemic consequences of poor oral hygiene. Dental decay causes extreme pain and thus preventable emergency room visits, and it's also a risk factor for things like cardiovascular and renal disease. So, armed with this knowledge, I had the pleasure of interviewing the director of the Hope Care Clinic, a volunteer run clinic offering free and low cost care to community members in Wenatchee. They actually originally did not plan on offering dental services, but a local dentist recognized that there was such a huge need in the community, and so they developed a dental program. Today, a majority of their patients are those who cannot afford dental care and come urgently seeking tooth extraction due to extensive decay. They've actually recently developed their own oral hygiene education program. However, their plans have been put on hold due to the logistics of running a volunteer clinic during the pandemic. So, with this in mind, my question became, how can community based organizations like the Hope Care Clinic develop preventative dental health interventions to best improve oral health outcomes for the low income patients who have such barriers to care? I set out to explore what other communities had done to address this issue. Through a literature review, I got to investigate a lot of interesting interventions, including things like smartphone applications and text messaging services, educational series with motivational interviewing techniques and risk communication, then mobile dentistry, just to name a few. I took a deeper dive into one interventional study surrounding the Minority Men's Oral Health Dental Access Program. This program utilized a what they call a community-based participatory research approach in order to investigate the effects of an educational program specifically on oral hygiene understanding and then increased self-efficacy surrounding dental health. The series itself was taught by trained dentists and public health professionals, and it consisted of things like didactics, tactical demonstrations, interactive discussions on implications and barriers to care. Something really fascinating about this study was that they used a truly community based approach to care. So they had educational series that were held at centrally located community college. They recruited based on relationships that they already had with community based organizations that served the population that they were targeting. And they also ended up training participants to act as ambassadors for the program. The results of the study showed that things like knowledge of gingivitis, knowledge of ways to prevent gum disease, knowledge of appropriate toothbrush use all increased. Several positive changes in attitude were also statistically significant, indicating more active approaches to dental care post intervention. A limitation of the study is that it was performed with a small sample size of individuals in urban Atlanta, so results may not be generalizable to those who do not fit the inclusion criteria. However, the community-based design of this intervention, I think, is especially applicable to the assets that Wenatchee already has to combat this issue. I think most notably the extremely dedicated volunteers at the Hope Care Clinic who already have plans for an oral health education program. This particular intervention stood out to me because of the community collaboration, which I think has historically been one of Wenatchee's really strong suits. This type of intervention could be done in collaboration with Columbia Valley Community Health and Confluence Health, who have sponsored similar educational series in the past. Likewise, the North Central Accountable Community of Health is all about partnering with community-based organizations and could serve as additional support. The Wenatchee Public Library has historically hosted similar series in the past that could serve as a centrally located venue. I really think collaboration among all of these community partners could facilitate a sustainable platform for this work in the long term. So that's a little bit about my project. I'd love to thank my mentor, Dr. McCarthy, who was instrumental in helping me formulate this project, and then Jenny Kerstetter, the Hope Care Clinic Director, for her time and all her wonderful support for my project. So thank you so much for listening, and I hope you have a great day.